Aloha everyone, my name is Alexander and my topic was Chapter 18, Drugs. So just an intro and preview to what we might be talking about later on in this presentation. I chose for an example LSD and the picture on the left. We're going to talk about its effects, drugs effects, and their negative effects on the body as well as their characteristics. On the right hand side we have a molecular structure of ecstasy. It is a derivative of amphetamine, so it's the same family but it just has a little more than amphetamine, which also means more side effects, more properties to it when you experience the high. And so to start, what are drugs? Drugs are a chemical compound. They alter and improve or degrade a person's body, health, state of mind, or our moods. The effects vary depending on the ingredients used to create the drug. The differing chemicals used to make a drug depends solely on the purpose they are created for. Drugs can treat illnesses, alleviate pain, support our immune systems, support or degrade mental health, boost awareness, induce paranoia, and cause addiction, and much more. Drugs can be natural. They can occur in nature, such as marijuana or tobacco plants, poppy plants, and they can be man-made or manufactured or synthetic. You choose what term you want to use, but for instance that will be like crack cocaine or meth. Classifications of drugs include depressants, stimulants, hallucinogens, analgesics, opioids, anti-inflammatory, and antihistamines. So just like there are many drugs, there are also many methods to consume said drugs. The name of the process when you do consume a drug and its interaction that it has within your body is called pharmacokinetics. So the first method of injection is of consumption is injection, and it's a liquid. So injection happens when it is injected to your body. It enters your bloodstream and is carried throughout your body, and your body absorbs the drug. Second form is inhalation. This is usually a gas or vapor. So this usually happens when a flame, a direct flame, for instance, lighting a joint for marijuana, or lighting a cigarette, or heat, indirect heat, so lighting a spoon with heroin, or a pipe with meth in it. This will heat it up and create smoke or vapors, which are then inhaled by the user. It enters the lungs, and just like our lungs take in oxygen and our body lives off that oxygen, if it's taking in these smoke and vapors, it is also absorbed along with the oxygen, which induces the intoxication. The exception can be cocaine, because cocaine has very many forms, and has other than one form and many methods of consumption. Ingestion is another method, is through the mouth. This is usually done by pills, tablets, or liquids. And just like our food, it's absorbed through digestion into our system. And cocaine and nicotine can be absorbed just through the gums orally. And LSD can be dissolved and absorbed on our tongues. So those are the exceptions. They don't always have to go into our stomachs. Pills are solids, and eye drops, just as our eyes get dry and we use eye drops and our eyes absorb that liquid, we can absorb other liquids containing other drugs, and is done so by the small surrounding capillaries within our eyeballs. So the first category, what are psychoactive drugs? They are substances that affect our brain and bodies. They affect the mental, emotional, and physical states of our human bodies. By introducing these substances, that will contain chemicals that we can or cannot find already in our bodies. They normally affect our dopamine and serotonin levels most commonly, but they can also increase or affect our adrenaline and norepinephrine. So some of them are manufactured or naturally occurring in nature. And they also are usually experiencing hydrogen bonds and dipole-dipole interactions or dipole-dipole forces, as we have learned earlier in this semester. These interactions and bonds take place within our bodies when the drug's chemicals meet our brain's neurons and they bind to them. Each drug has a different molecular structure, which will determine its ability to bond to the neurons and its effects that it has on our bodies and brains. It also will determine the rate of absorption and how fast we will feel the effects. I will talk about that more later. The various types of psychoactives, stimulants, so like Adderall, helps you focus, so that antidepressants, the complete opposite of stimulants, you'll feel more calm, depressed. Antipsychotics, benzodiazepines, I'm sorry if I butchered that. We commonly probably heard of Valium. Sleep aids, Ambien. Alzheimer's disease treatments, Aricept. And other drugs include, usually the common ones we hear a lot about is cocaine, crack cocaine, MDMA, or also known as ecstasy or Molly or XTC, peyote. It's a natural occurring one in nature. It's a plant. We have LSD, psilocybin, magic mushrooms, also known as. We have Salvia divinorum. It's a plant that is normally smoked, and cannabis, which holds THC, and then diphenhydramine, or also known as the brand name Benadryl. So many psychoactives can be classified as a depressant, a stimulant, or a hallucinogen. Like I mentioned, it can be one, it can be two, it can be many, as they tend to cause those types of reactions or numerous reactions that fall within those categories. So the two chemicals within our brains that are often affected the most through these drugs are dopamine and serotonin. They're very similar. So dopamine is the feel-good chemical, increases feelings of happiness, causes neurotransmitters to fire at rates that the brain normally would when a person experiences feelings such as happiness and joy. Serotonin, very similar, is associated with happy feelings, but usually more for like satisfaction or intense pleasure, and our sleep is necessary for sleep. It also helps regulate our moods. That's why we're grumpy when we don't get enough sleep. So, between the two, when the brain naturally produces these two chemicals, and then we consume drugs that increase these one or two of these levels to extreme highs, once the drug wears off, our brain craves that intense firing of our neurons. But because our bodies and brains can't produce that naturally, we have the crash. And so that leads to addiction, because our bodies now crave to feel good. We crave what makes us feel good. And that would be the drugs. So the crash, come down, is normally often misconstrued. It doesn't mean our levels are going lower than normal. Sometimes it just means they return to normal, but because we just came off an extreme high, that normal feels less than normal, if that makes sense, leading to depression. Next is absorption. Psychoactive drugs are considered highly lipid soluble. So this includes THC or marijuana, cocaine, which easiest way to explain that is when you watch movies and someone snorts cocaine, they immediately get really amped up. That's because it's highly lipid soluble. It's easily digested or absorbed through our bodies. LSD and amphetamines are also highly lipid soluble. So, like I said, it's the ability to dissolve in fats or lipids and break through our membranes in our bodies, which allows for absorption. This should look familiar to all of us. This is just a chart showing the structures of our chemicals that we find in our bodies and that can be supplied by the drugs and the role that they play. So adrenaline would be a stimulant. It would be, for example, cocaine. Concentration, so noradrenaline can be Adderall. Dopamine, MDMA, serotonin, also MDMA. Dopamine and serotonin can also be marijuana. On the left hand side, we have a picture showing on top antidepressants and how the receptors interact with our bodies and the neurons and receptors in our brains. The bottom left is psilocybin or the magic mushrooms. Also, their structure and how they interact with our receptors and how it's absorbed, just to get a visual. And on the right hand side is the structure for MDMA, or also known as ecstasy. To kind of explain this a little bit deeper, it's ecstasy is normally it's a weak base drug, so it's likely to want to pick up a hydrogen ion when it enters our body, and this creates the high, the effect that we feel. The hydrogen exchanges the firing of the neurons, and the drug doing its job. The bottom right is how MDMA can look. It's often a fun drug. People take at parties, a party drug, so they want to make it look fun and attractive to take. Opioids are probably the most highly addictive out of all the drugs. They are often used to treat pain or extreme pain, and they're often classified as depressants. They form hydrogen bonds, and the risks include addiction, overdose, constipation, fragile bones, depression, and breathing problems. So the depression and the breathing problems come from the activity that occurs in our brains with our neurons and our exhausted neurons after we come down from the high. Examples are heroin, morphine, codeine, and oxycodone. And so we already have opioid receptors within our bodies. So when we supply them with excess, they get overloaded, and then later we crave them more when we crash. Analgesics or NSAIDs, they can be opioids or non-opioids, and they're often used to treat pain or block pain, manage pain, and also used as anti-inflammatory agents. So 3 very common analgesic chemicals that we find in medications are salicylic acid, also found in skincare products, propionic acid, and acetaminophen. It's probably the most heard and common one that we hear about. They all work similarly in the body to reduce pain and inflammation. Next, that leads into antihistamines. Sort of same thing, they reduce inflammation, but they specifically treat allergies. So allergies are caused in our bodies by the introduction of a foreign protein floating about that comes into contact or laying about. It can be in detergents, fabric, or the air in our plants. So the foreign protein comes into contact with our body, and our body reacts in efforts to counter this protein by sneezing, runny noses, itchy eyes, throats, and or itchy ears, coughing, hives, etc. Antihistamines block the effects of histamines, which is a chemical released by our bodies during these allergic reactions. So the antihistamines prevent the binding to our receptors from the protein, which will altogether stop the allergic reaction and give us relief. Environmental and sustainable concerns, sustainability concerns involving these drugs is water usage. A lot of water is used in production, and it's also used in the farms for the natural occurring drugs like marijuana and tobacco and poppy plants. The factories that the synthetic drugs are produced in emit a lot of carbon emissions into our atmosphere, so that brings up concerns with our carbon footprints. Another concern, addiction leads to homelessness sometimes, unfortunately, and that also unfortunately leads to pollution due to their living conditions. They may not have necessary sanitation, and sometimes their trash can blow about in the wind, and down the road it leads to environmental problems. Sometimes these drugs will be flushed down toilets and end up in our water treatment supply, and it can cause some problems. It's also traceable in our waste system. Natural resources loss, such as natural plants and, like I mentioned earlier, water, but natural plant compounds are used because they contain alkaloids, which are used to create opioids. Another thing is biodiversity loss altogether. It's just concerns within nature, plants, and animals. Conclusion to this, all drugs work similarly. They either add chemicals foreign to the human body or add chemicals we can already find within ourselves. Their differences is their intended purposes. So some are more addictive than others and more harmful to some extent than some others might be. It all depends on our usage and whether we are responsible or we abuse the drugs. Do they do more good than bad is a constant debate, but while they all have their side effects, severe or minor, we just hope that one day technology and medicine will make advances to where we don't have to worry so much about the negative effects, and hopefully we can reduce the risk of addiction. My 3 test questions I hope you learned from this presentation would be question number 1. Name the 2 chemicals psychoactive drugs affect in the brain. Question number 2. Name the type of bond present with opioids. Question number 3. List 3 classifications of drugs. The answer to number 1 is dopamine and serotonin. Answer to number 2, hydrogen bond. Answer to number 3 can be any 3 of the following: depressants, stimulants, hallucinogens, opioids, antihistamines, anti-inflammatory, and analgesics. This is my work cited and references, and thank you again for watching.